Wolf's Lair, East Prussia, late autumn 1944. A concrete room under an electric lamp, disinfectant in the air, a military map on the wall, the Eastern Front drawn in retreating arrows. A leather-bound notebook lies open on the desk. The physician loads a syringe from a brown glass ampule. The label reads Eucadol. The patient sits in a wooden chair. His left hand moves in a slow rhythm, 4 to 6 cycles per second, independent of command. The needle enters the left arm. 90 seconds later, the hand is still. The tremor has chemistry. The patient on the table is Adolf Hitler. The physician is Theodor Morell. The year is 1944. The Red Army is 400 kilometers east. The Wehrmacht is bleeding men it cannot replace. Hitler does not yet accept that the war is lost. Hitler's left-hand tremor was a rest tremor, 4 to 6 hertz. Inner staff observed it from 1942. By late 1944, it appeared in newsreel footage for the public to see. The posture was stooped. Speer describes a shriveled man whose heavy footsteps dragged. The uniform was stained with food Hitler had eaten. The voice was low-pitched, intermittently slurred. The face was masked. The left leg dragged on the concrete floor. The notebook on the desk belongs to Dr. Morell. 883 days of treatment across 9 years, 74 substances, 28 custom mixtures. A complete pharmacological record of patient A. The ampule is one entry in that record. Case file opened. The pharmacological inventory in order of introduction. Pervitin, methamphetamine tablets. Timmler Verka, Berlin, 1937. Between April and July 1940, 35 million tablets were distributed to the Wehrmacht. The diary records Hitler's personal use from 1941 onward. The compound quickly crosses the blood-brain barrier. Then it floods the mesolimbic pathway with dopamine. Euphoria follows. Vigilance, a compressed sense of time. Vitamultin, a proprietary Morell compound sealed in gold foil. Administered daily, oral or injection. In 1943, Ernst Gunther Schenk, the Reich nutrition inspector, tested Vitamultin. He discovered methamphetamine in the product. Hitler was never told. The result? Unwitting methamphetamine ingestion daily for years. Eucadol, oxycodone. Merck synthesized 1916. First injected intravenously in July 1943. By late 1944, the dosing reached 20 milligrams every other day. The standard medical dose was 5. The subject was receiving 4 times therapeutic. Physical dependence is pharmacologically established after 2 weeks. The dosing schedule made withdrawal inevitable. Cocaine, a 10% solution applied to the throat and sinuses. Use started after July 20th, 1944. That was the day Stauffenberg's bomb burst both of Hitler's eardrums. Administered by Dr. Giesing, an ear-nose-throat specialist. Barbiturates and Brom Nervacid, for sleep. Final bunker months, 1945. The pharmacological record is documented. The diagnostic framework is modern. 3 diagnoses stack on the documented record. First, stimulant use disorder, DSM-5 code 304.40. 4 of 11 criteria resolve on primary evidence. Criterion A.10, tolerance. Vitamultin frequency escalates across the diary from 1941 to 1945. The same dose no longer produces the same effect. Criterion A.11, withdrawal. Between injections, Hitler is exhausted and irritable. Minutes after the next dose, he recovers. Speer observes the transformation firsthand. Criterion A.6, continued use despite interpersonal problems. Paranoid episodes intensify after July 1944. Execution orders follow. The dosing does not pause. Criterion A.9, continued use despite physical harm. The tremor is visible. The gait is impaired. The injections continue. 4 criteria cross the threshold. The diagnosis is severe. Second, opioid use disorder, DSM-5 code 304.00. Eucadol was administered intravenously from July 1943 at 4 times the therapeutic dose. Physical dependence was pharmacologically guaranteed within 2 weeks. Tolerance escalated through 1944. In January 1945, Merck's supply chain fails. The bunker records show withdrawal. insomnia, irritability, collapse judgment. Third and foundational, narcissistic personality disorder, DSM-5 code 301.81. Pre-existing, pre-drugs. Witnesses at the Munich beer hall in the early 1920s noted grandiosity, entitlement, and a lack of empathy. This was 20 years before Morell's first injection. Kernberg's malignant narcissism. Framework captures the full presentation. The drugs did not supply the personality, they powered its motor. A clinical distinction is necessary. The drugs did not cause the ideology predates the drugs by 2 decades. The drugs made the execution of that ideology faster, more rigid, and more detached from reality. The comorbidity is textbook. The neurological consequences follow from the mechanism. Methamphetamine, acute. A single dose floods the synaptic cleft with dopamine. The mesolimbic and nigrostriatal pathways light up. The result is euphoria, vigilance, grandiose affect, compressed time perception. Methamphetamine, chronic. Receptor density collapses. Dopamine transporter levels fall. A 2001 study by Volkoff at Brookhaven and UCLA found that chronic meth users had a 24% to 30% drop in striatal dopamine transporters. The prefrontal cortex controls judgment, impulse control, and mental updates. This area can face both structural and functional damage. The behavioral signature: cognitive rigidity, paranoia, fixation on failing strategies, failure to revise plans against new evidence. The Parkinsonian tremor is observable from 1942, bilateral by 1944. The cause could be idiopathic Parkinson's, drug-induced Parkinsonism, or post-viral. Chronic methamphetamine does not cure any of them. It accelerates all 3. The Eucodol overlay adds opioid euphoria on top of stimulant dysregulation. Reality becomes optional. The brain making the decisions was no longer capable of making them well. The paradox is pharmacological. April to July 1940, Temmler-Werke, Berlin. 35 million Pervitin tablets distributed to the Wehrmacht. Panzer crews drove 3 days without sleep. Luftwaffe pilots held alert through the Ardennes breakthrough and the push to the Channel. Methamphetamine won the Blitzkrieg. The same compound was dismantling the cortex of the commander who had ordered its distribution. The drug that gave the army its tactical edge was destroying the brain issuing the orders. December 1944. The Ardennes Offensive, dictated personally by Hitler. Briefings at Ziegenberg show a bent figure at the map table. The left arm twitches. The hand stays hidden. The offensive fails within 6 weeks. January to April 1945. The Führerbunker, Berlin. Merck's Eucodol supply chain collapses. Withdrawal begins. Orders go to armies that no longer exist. Steiner's Phantom Group, Venk's Relief Force. Drawn on situation maps, the real front had outpaced weeks earlier. April 30th, 1945. Hitler dies by suicide. Morell is not there. He had been dismissed 8 days earlier. The diary ends. The file returns to the first page. Return to the room. Wolf's Lair. Late autumn 1944. The concrete walls. The electric lamp. The map with its retreating arrows. The notebook on the desk. The brown glass ampule is Eucodol. Oxycodone. Merck, 1916. The injection has silenced the tremor for 90 minutes. Then the hand begins again. The record shows stimulant use disorder, opioid use disorder, and pre-existing narcissistic personality disorder. The physician will keep writing entries until April 22, 1945. The patient will die 8 days later. The diagnosis stands without the dramaturgy. The drugs did not make him a monster. The drugs made the monster efficient.